So before the chairside assessment, you will take 5 x-rays on Dexter, and we will tell you 3 PAs and 2 bite wings. So whatever number we tell you, take a PA on number 2, center number 2. Take a PA on 30, center number 30, so on and so forth. It's not the same teeth you would center in an FMX. So center whichever teeth we tell you. You'll get 5 x-rays, and you can do that anytime before the assessment. Process them, and then the day of your assessment, make sure they're mounted in a full mouth x-ray mount and on your view box. Those will be your patient's x-rays. One thing that students get confused by is they think that the x-rays we assign to them for chairside have something to do with the teeth we're working on, and they don't. They don't have anything to do with it. So take your 5 x-rays. The day of your assessment, the things that you can have set up before we start your setup time, you can have your instruments checked out and in order on your tray. You can have your burr block checked out in whatever order you want the burrs to be on your burr block. You can have your hand pieces oiled, and you can have your barriers, HVE, air, water, syringe, those types of things in the operatory. And you can have your patient picked out, and you can stuff Dexter's head if you would like to do that. All of these things need to be in the sterilization room, or at least not in the operatory itself, because hypothetically there's still another patient in the operatory, and those are all things that you have access to in the sterilization room, minus your patient. So all of those things can be set up. Once you are ready to start your 10-minute setup time, come to Miss L or I, and we will give you a patient chart. You will go over the health history like you did for anesthetic assessment. We happen to be working on Matthew McConaughey today, and tell us everything that's on his health history that he has checked yes to. In this case, he has jaw pain, and more importantly, he had rheumatic fever at some point, and so he now needs to be pre-medicated with antibiotics before his appointments because it affected his heart. And so we will use without epinephrine. The doctor will tell you what kind of anesthetic they'd like to use, and if they don't, just ask them what kind you want. They want. And then tell us what teeth we're working on. So today we're working on occlusals on 28 and 29 and a distofacial on 26. So that tells me I need a long needle. The rheumatic fever from his health history told me, or the doctor, that we're using without epinephrine. And as soon as you leave our office, ask what burrs the doctor wants first if they don't tell you. So today we're going to use a 557 and a 6. And as soon as we go over the health history and tell you what burrs we want, you can go ahead and start your 10-minute setup time, which is bringing all of the things you had set up already, tray, burr block, hand pieces, patient, into the operatory. And then you can get the rest of the materials that you need out of the brown tubs. One thing that is my preference is if I need to run over or get points taken away on anything, it would be the setup time, because I would rather know everything was here that I needed and miss 2 points off of the entire assessment instead of wondering the whole procedure whether I had everything that I needed or not. So if you needed to give some points somewhere, it would be for me in my setup time. Try to set up in 10 minutes, and if not, that would be where I'd go over. So I'm going to, we have everything set up now. I'm going to go ahead and put Matthew McConaughey's folder in the box on the wall. I am going to leave his health history sticking up, but behind other things so other patients can't see it. In the view box so the doctor can just review it, pull it up and review it before they start working. So when you're finished with your 10-minute setup time, go ahead and let the doctor know, because we're going to assume, Miss L and I will assume, you're still setting up until you tell us otherwise and tell us that you're ready for your patient. So let's go ahead and lock him in. So when the doctor comes in, the first thing we need is Mouth Mirror Explorer. And if you have time in your 10 minutes, it is always a good idea to go ahead and place the topical. And we are working on mandibular, so way in the back for our long mandibular injection, and a supplemental injection up around 26 since it's so far away from the nerve trunk. We'll go ahead and put topical there too for what's called a supplemental injection. So I'll put that all the way in the back, and then in front of 26, and sit there. If you don't have time, if something comes up or you're running behind schedule, or they change procedures, the first and foremost thing that you need to have ready, even if you don't have anything else on your tray ready, is Mouthmare Explorer, because that's always what they'll use first, and anesthetic. Because after the anesthetic, we have about 5 minutes for that to take effect, that we could go and get everything else, or have a rover go do that for us. So always have your anesthetic ready to go. So doctor's in here now. I will take the Q-tips, put them straight into the trash so they don't junk up your tray. Mouthmare Explorer, 26, 28, and 29. Anesthetic is next. I'm going to grab a needle guard. Okay, so confirm we have without epinephrine in the syringe. Loosen the cap. Yes, you may. Swapping out the anesthetic. Make sure you don't throw the carpules away, because you have to write down how many and of what type when we're finished on the chart. Give them a rinse. Make sure and rinse the quadrant and the tongue in the area of the injection. This does not need to be a full mouth rinse. It's just in case you dripped any anesthetic from the anesthetic syringe onto the patient's tongue. It tends to be very bitter. So at that point, the doctor will get up and leave, and you are ready to put your rubber dam on. Oh, I need you to sit down. We're going to check for a composite shade. You can do one of two things. You can either tell the doctor, I thought A2 looked good, or whatever shade you think matches that patient's tooth. Make sure you're matching it to the tooth that we're actually working on. Students have a tendency to match it to 8 and 9. We're working on 26 today. Those can be two